Welcome! I'm Ashley from Demystifying Your Health. Today we're going to be talking about the differences between pneumonia and bronchitis. You have a hacking cough with fever, chills, shortness of breath. So you know that you're sick, but you don't know what is causing you to be sick. And this is actually really important because the treatment between pneumonia and bronchitis is actually very different, and so is the recovery time. Let's find out what these differences are. So with pneumonia and bronchitis, there's some similarities and there's some differences. Pneumonia is caused by bacteria, and it inflames the air sacs, or the alveoli, which are the very bottom part of our lungs, and this is where the actual exchange of oxygen and carbon dioxide occurs. So in pneumonia, these alveoli actually fill with fluid or pus, which makes that exchange hard to do. With bronchitis, they're usually caused by viruses. And this is when the linings of the tubes that carry air to and from your lungs, the bronchioles, become inflamed. So this makes it incredibly hard to get air in there because of that inflammation. And bronchitis is further broken down into two types. We've got acute or chronic. Acute is the one that we're talking about today, where it comes on suddenly due to some sort of illness, infection, and then it will get better. Chronic bronchitis is something more like chronic obstructive pulmonary disorder, or COPD. This is something that's a long-term condition that you're having to deal with that results in inflammation of the bronchioles. Obviously not a good situation in either case. And when it comes to symptoms, there's some similarities here and some differences as well. So for pneumonia, you're going to have coughing, chest pain when you're breathing or coughing, fatigue, fever, sweating, chills, shortness of breath, phlegm. Usually the phlegm's clear. There's no discoloration. It's clear phlegm. Sometimes it's thick, but it's clear. And then nausea, vomiting, or diarrhea. With acute bronchitis, you're more likely to have shortness of breath, coughing, a slight fever, chills, fatigue, chest discomfort, mucus. Once again, you're going to be bringing up mucus, but this time it's going to be plenty of different colors, usually a range of either yellow, brown, or green. And the cough that's going to last several weeks, like 3 weeks or more. And this is even after the inflammation is gone. And then because of the inflammation, making the tubes smaller, it makes it harder for air to get in and out. Therefore, you might have a wheezing sound, which is where the air is trying to pass through that narrow opening. And when it comes to pneumonia, there's also a few types of this as well. You have mild or walking pneumonia, which means you have pneumonia. It's just that you're not as sick as someone who requires bed rest. It doesn't mean you should be up and about and around, because obviously you don't want to give the infection to someone else, but it just means you're not as sick. The community acquired is the most common, and this is where you're out and about doing your normal routine, and then all of a sudden you end up sick. With healthcare acquired pneumonia, this is where someone gets pneumonia when they're already in a healthcare setting, such as a hospital or a nursing home. And this is usually concerning for a couple of reasons. One, these type of pneumonia infections are usually more resistant to treatment, so they're much harder to treat because they're resistant to the antibiotics that are normally used to treat community acquired pneumonia. And then the other big issue with it is people who are in healthcare settings usually have a weakened immune system because obviously they're in the hospital, or in a nursing home, they're elderly, which makes their immune systems weaker because of being just natural aging process. And so these individuals are at higher risk for complications. So if they get a healthcare acquired pneumonia infection, which is harder to treat, and they already are predisposed to complications, it's just that much more of a concern when you're trying to help them get better. When it comes to treating pneumonia or acute bronchitis, they're pretty much the same. The only real difference is that you're probably going to get prescribed antibiotics by your doctor if you have pneumonia, and this is because it's caused by bacteria. And antibiotics work on bacteria, but not viruses. Since acute bronchitis is usually caused by viruses, the antibiotics won't work. In either case, though, there are several over-the-counter treatment options that you can do. One of them is cough medicine. Sometimes your doctor will prescribe you prescription strength cough medicine, if they feel that you need it. Otherwise, they're going to recommend that you go to your local pharmacy and get cough medicine from there. And there's plenty of different options. So if you need guidance in this, definitely talk to your pharmacist or your doctor. As far as the other things you want is a fever reducer and pain reliever. Good news is these are usually in a combination medicine. You can get this either through acetaminophen, which is Tylenol, or through ibuprofen, which is Advil or Aleve. Just bear in mind that sometimes even cough medicines, especially if they're over the counter, have some form of these fever reducer pain medicines in them. So make sure you're reading the label, and if you're unsure, ask the pharmacist while you're there, because this is important. You don't want to take too much of this because obviously that could cause an accidental overdose, which is not good either. Next big thing after medicine are actual steps to take. And number one is resting. You need rest. Your body, when it's fighting an infection of any kind, needs rest. This is how your body fixes itself. And then you want to stay hydrated. The other big thing your body is going to go through when you're sick is water. So you need to drink plenty and plenty of water. Avoid caffeinated products like sodas, coffee, anything like that. You want to drink water. If you have nausea or vomiting or diarrhea, you want to drink things that have electrolytes in them, like sports drinks, to help replace those electrolytes that you're losing. And then it can be helpful to use a humidifier. These things provide moisture into the air, so that way it makes it less irritating, so you're coughing less. The good news is that nowadays we have cool mist humidifiers. Way back when, they had warm humidifiers, and those, obviously the big concern there was getting burned because you had hot water on the floor, so you trip over the device, you spill the water, now you're burned. With the cool mist humidifiers, you don't have to worry about that. You get that moisture in the air and the benefit of it without that concern. Other option here is you can take a nice warm shower. That steamy shower helps humidify things, break things up. You'll actually feel probably a lot better. If you don't feel like getting in the shower, you can just turn the shower on and be in the bathroom. And then avoid irritants like smoking or cleaning products that have heavy fumes, anything that's going to cause you to feel like you need to cough more. You want to avoid those definitely. So by following all these, you should be feeling a lot better within a couple days. That doesn't mean go out and do your normal activities. You're probably not going to feel like it anyway, but definitely, this is going to provide you some relief, and that's the big thing. Is you want to get some relief until you're feeling back to your 100%. There are things that you can do to prevent both pneumonia and acute bronchitis. You'll never guess what the number one thing is. Washing your hands frequently and thoroughly. I know I cover this a lot in a lot of my videos, but this is so key to infection prevention. And you want to wash your hands with soap, warm water, rub vigorously, cover all parts of your hands, the back of your hands, your thumbs, all of it. You want to get your hands clean. This is the best way to remove germs. And you want to do this before and after going to the bathroom, before and after food prep, and if you cough or sneeze into your hands. If you don't have access to soap and water, then an alcohol-based hand sanitizer is usually the next best option. If possible, try coughing or sneezing into the crease of your elbow. This way it avoids getting it on your hands at all. And then the next big thing is avoid others who are sick. And I know this is hard to do. When you're out doing errands or anything else, interacting with others, you don't know if someone's sick necessarily. But if you can tell someone's visibly sick, try to avoid being around them. And then you want to get vaccinated. And this is so important because both acute bronchitis and pneumonia are usually the result of having some sort of infection first, such as the flu. So, for bronchitis, you want to get the flu shot yearly. So this is important because if you prevent the flu, then you're also decreasing your chances of having acute bronchitis. For pneumonia, you want the flu and pneumonia shots yearly. Usually the pneumonia shots is age dependent. It's usually for a certain age group and above, so make sure you talk to your doctor to see if they recommend it for you. It also can be indicated for those who have weakened immune systems. And then the next big thing here is don't smoke or be around others who do. Smoking actually damages your lungs, or exposure to smoke damages your lungs, which can result in having you have damage that causes you to be more susceptible to either acute bronchitis or pneumonia. So these key things are going to be what prevents you, hopefully, from getting either pneumonia or acute bronchitis. No one wants pneumonia or bronchitis. Hopefully, these tips will help you prevent it to the best of your ability. However, if you do get sick, take comfort in knowing that with the proper treatment, you'll be back to feeling like your normal self in no time. Thank you for joining me today. If you have any questions or comments, please put them below or send me a message. I'd love to hear from you. Please like, share, and subscribe. Until next time, stay healthy.